joined the conference.
Okay, but they're trying to switch it. We'll talk. Hey, Berlin.
There are 8 participants in the conference. The following 8 participants are in the conference.
Scott Gregory to answer questions.
Missy Jensen.
A.V. Room.
Rick Betthummel, Meritain.
Amanda Weaver.
Susie Duranzo. Shay Beerley.
Chris Marsh.
Please rise.
Chris Marsh
has left the conference.
Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. Okay, this is the quarterly meeting of the Mojave County Employee Benefit Trust Fund, the Board of Trustees. It's Wednesday, August 26, 2020 at 9 a.m.
Has joined the conference.
Okay. Do we have a quorum, clerk?
Yes, ma'am.
And let's make sure everyone's on the phone who needs to vote.
Susie Duranzo?
Here.
And I believe that's your only member on the phone.
That's the only member. Okay, so we have a quorum. All right, so let's get right into it. The official business to come before this board. Our first is a call to public. Does anybody have any comments for this board? Seeing and hearing none, we'll move on. Opening remarks and introductions, Mr. Collins.
Madam Chair and trustees, thank you for the opportunity to present today and to go through this agenda with you. Just for the record, we have 3 vendors on the phone. They will not be making presentations, but their reports are included in the packet. That's Buck, Navitas, and Meritain, and so they're on until we get to their items. They'll probably drop off, and if the board doesn't have any questions. Item 3 on the agenda is the merger for ECA, Aaron Collins and Associates, and Gallagher. Scott Gregory, are you on the line?
Yes, I am. Good morning.
Thank you. Morning, Scott. So, Madam Chair, Scott Gregory is the regional president with the Southwest at Gallagher. He and I are going to tag team a little bit to do the presentation. The background is, you know from the email that ECA, effective on September 1st, has merged/sold to Arthur J. Gallagher. I realize for a lot of our clients this is somewhat of a surprise. Change is always tough. So I just wanted to run through with you what the thought process was on the change, and then Scott and I will tag team again on Gallagher. So to cut to the chase, when you're a small firm like us, I mean, frankly, kudos to Kingman. The company started here on my kitchen table back in 1992. We've grown to now the largest in our segment here in the state of Arizona. But as that time clicks, and you have to figure out what are you going to do when it's time to move on one way or the other. A lot of things went into that consideration. As you have seen, I know, Madam Chair, you and I have commiserated a number of times over the years about continued federal involvement and the complexity and the regs and whatnot. IT is my personal favorite thing to hate. This is what wakes you up at 2 o'clock in the morning, is the pimple-faced kid in their basement who's hacking people's servers. And for a small firm, I will tell you that it's a pretty great point of pride for me that we have invested a lot over the last 28 years in keeping up on both of these, and also on the regulatory changes, the staff meetings and whatnot, staff training, But the reality is you look down the road and realize it's beyond the resources that you have. Staff is always an issue, continued availability of staff, do you buy them, do you build them, that type of thing, and frankly, it all takes money. So, and when you're in a position like ours, the phone does ring. We've had a handful of offers in the past and discussions and never taken them. Gallagher was different. They called 2 years ago. We did not disclose to anyone that we were in conversations with them. My staff didn't know until January, and they were told in January because we thought we were originally going to close this in February or March, and then COVID hit and the world changed. So that's why we're back to September. So things will change when we make this change. Everybody says, nothing's going to change. The reality is it is going to change. We believe it's going to be for the good. The name of the company will change initially from Aaron Collins & Associates, Aaron Collins & Associates, to Gallagher Company. That'll run through June of 2021, and then in July will just be Gallagher full-time. Driving all of this is the back end. And here's what I really believe is going to happen. I think for us, life is going to be miserable for about 4 or 5 months. We're going to switch IT, we're going to switch phones, we're going to switch billing mechanisms and that type of thing into a corporate structure from the fairly looser thing of a small company. But from your side, what I believe you will see gradually is you'll see the increase in the availability of the resources. I mean, they just bring ridiculous amounts to the table in terms of professional development, people you can call, and specialty practices. So that depth of support, that the IT, I want to look away and say bad words every time IT comes up. But the regulatory changes, all of it, they just bring so much there. And perpetuation is key because for me, it was always, do you buy staff? Go find people who actually do it or train them up. But Gallagher is so large, and they have compatible practices in the single entity space all throughout the country. For our multi-employer practice, they actually have similar practices, do essentially the same thing in other states. Things that won't change, management staying in place. Unfortunately, I don't get shot and sent off to retirement somewhere. I will say, I have to say a minimum of 3 years, and I've been asked a million times, how long will you really stay? It'll be somewhere between that last heartbeat and 8 years when I get my full Social Security. The service team will stay on, Amanda, Missy will stay. So all of that stays unchanged. And on the scope of services on the contract, which is what you're going to vote on later, what we're doing is a contract assignment. And the reason we're doing it that way versus a new contract is I want you to be assured that the scope of services we have agreed to provide will not change. Okay, so Ryan will handle that in an E-session or however you want to do it. But in essence, what happens is the contract goes over, everything stays the same, the name changes. Okay? And I wanted to make sure that all of our clients were confident that there would not be changes to what we do and how we do it. And that contract assignment is kind of the legal way of making sure that happens. And then the operating philosophy the same, the customer service, the innovation. Scott will get into it, but that type of thing that's made us successful over the years, why Gallagher was interested in us. Why did I choose Gallagher when there were other ones out there? Ironically, I first worked with Gallagher when I was Mojave County's personnel director, about 1986. They are the group, and some of you may know Bill Hardy, who runs ASIP, but there's a guy behind him by the name of John Chino, who has been on the county from the Gallagher side from 1986. So I worked with them first here. I worked with them in New Jersey, in Arizona, in New Mexico, in London for over 35 years. They have complementary practices. The values are aligned, and when I say that, we've been negotiating for 2 years, off and on. The consistent message has been that if you want it, if this is what we'll do, we will do it, and they put it in writing. And then I put in the bottom, just as a quote here, because it was kind of interesting, when my wife and I realized we were going to get serious about this, we didn't want to jump, we didn't want to do things rapidly, so we kind of sat down around our kitchen table one weekend and said, all right, we're going to do it, what's our criteria going to be? And in essence, it boiled down, and we said it's got to be right for our clients. It has to be a partner that where the values, the ethics, the work approach is the same. It has to be right for our employees. We don't want to be coming in swinging an axe, cutting heads. And obviously it has to be right for us as the founders. So that was how we approached the conversations. Last October, we went back to Chicago. We met with Scott. We met with a bunch of their senior folks, the finance people. We, did the dinner and the meeting, but then we got into it pretty deep. And the head of the practice, the head of the global practice, at dinner one night, the second night, or the first night, excuse me, said off the cuff and not being aware of that conversation that we look for partners. They want it to be right for the clients, the employees, and the owners. And so we dummied up, but as we flew home, we thought that was pretty serendipitous and kind of cool. At this point, I'm going to turn over just to have Scott introduce Gallagher. Scott?
Yes. Well, good morning, everyone. Thanks for having me here virtually today. Sorry I am not there in person with the majority of you today. I do look forward to meeting you throughout this process. So, as Aaron said, my name is Scott Gregory, and I am the regional president for the Southwest region here at Gallagher. I lead our employee benefits team, and our Southwest region is comprised of Southern California, Arizona, Nevada, and New Mexico, and I am based out of Los Angeles. And I've been with Gallagher for the past 15 years, and prior to coming to Gallagher, I was with a small brokerage firm with about 10 employees. We did employee benefits and property casualty. I spent 11 years there before coming over to Gallagher. My career at Gallagher, I spent the first 5 working directly with clients on my own kind of business, if you will, and then the past 10 years I've spent in leadership. I spent 7 years in our Orange County office, actually working with John Chino, 3 years in Los Angeles, and then most recently for the Southwest region. So a little bit about Gallagher for those of you that this might be the first time that you've heard of Gallagher. So we were founded in 1927 by Arthur J. Gallagher, and our leader today is Pat Gallagher, who happens to be his grandson. So it still feels like a family company, even though we are publicly traded and one of the largest benefit property casualty firms in the world. We do have about 30,000 plus employees across the globe. We went public in 1984, and that's really where a lot of the growth took off, and we've grown both organically and through merger partners, which I'll talk a little bit about in a little bit. Under the Gallagher umbrella, there's really 4 major departments, if you will. There's the employee benefits side, which is what I'm on. There's our property casualty side. There's a wholesaler on the property casualty side called Risk Placement Services. And then we have a large TPA, or third-party administrator, on workers' comp called Gallagher Bassett. And those are the 4 kind of enterprises, if you will, underneath the Gallagher umbrella. Hopefully, if you're looking at the slide there, certainly we've earned a number of awards, but the one that I'm most proud of in working here at Gallagher is the Ethisphere Award, where we have earned for 8 years in a row one of the world's most ethical companies, and we are the only brokerage risk management firm to be on that list and to ever be on that list. And I think it's just a foundation of how we do business. Trust is really what it's all about. So our formula, I mentioned we grow through organic and through merger partners, and it's really about us adding talented individuals, whether that be one by one or by firms, and we're looking to find different ways of how we can grow subject matter experts that can then understand and build further within Gallagher. So on the next slide, you might be asking yourself, okay, that's about Gallagher. What is Gallagher's interest in Aaron's firm? So we do have a small footprint today in Arizona on the benefits side. We acquired a firm about 3 years ago that does a little bit of employee benefits. And then we also acquired a firm about 5 years ago that does executive benefits. So think life insurance, high-end life insurance. And we think Arizona is a growing market for us and one that we want to have more expertise in. So we have been actively looking for those that have a strong footprint, strong local knowledge, and that's what I think we have found in Aaron and his entire team. So they have the professional reputation. That is what we're looking for. We can't change that overnight. If someone has a bad reputation and they have business out there, that's not someone we're interested in. So we believe that there's a great quality of people there. With Aaron and his team, we've spent a lot of time together, getting to know him, getting to know his team, and starting to get to know all of you as well, so that this can be a successful merger for everyone. I can't emphasize enough the points that Aaron already mentioned about the shared values. That is critical. Critical to us, critical, I think, to all of you as well, and we believe that we have found that. Aaron mentioned a little bit about our complementary practices. The public sector happens to be one of our largest areas of expertise outside of healthcare within all of Gallagher. We have a little bit of focus in Arizona, but certainly we're excited to have more of a focus there. Some of the extras that we bring and have available. So Aaron's team is the one that will continue to service you. We hope that we can provide his team with the subject matter experts, the bench that, when and where required, his team can reach out to. And if that gets to you, great. If it gets you indirectly, that's fine as well. So whether it's IT, which he talked about, compliance. We have over 35 compliance attorneys on staff, just on the benefit side. Whether it is certain practice areas like well-being or actuarial, retirement, communications, you name it. We have a lot of those needs. Anything that touches organizations and their employee needs, that's what we have available to help and assist. It has become more difficult to do this, and be the expert in every single category. And so this is kind of the model that we have built that I think supports our clients and our employees. So that's a little bit about Gallagher and our excitement about this opportunity. And with that, I'll turn it back over to you, Aaron.
Thank you, Scott. So, Madam Chair, at this point, I'd be happy to answer any particular questions. What you've got is when we come through, there's a two-part motion. The first is to assign the contract or not. And then if you do assign the contract to Gallagher as of September 1st, it would be to authorize Ken, I believe it's Ken, to sign basically sign the paperwork, which we've given to Ryan for review, that would just signs the contract over. So beyond that, I'm happy to answer questions, Madam Chair.
Okay, thanks. Anyone have any questions?
Madam Chairman, This is Susie Duranzo.
Okay, Susie.
I have a question. Okay, I do understand that there would be no changes in terms of services to be provided to the employee during the transition period. However, there's some legal stuff we need to go through, which is the execution of the document for the assignment of this contract. Now, I do understand that it would be worked with Ken and our trust attorney, but since we are an advisory committee to the Board of Supervisors, would this contract go back to the board for its approval? Board of Supervisors, I mean, since we're just advisory to the board.
Susie, I agree with you. That's what I was going to ask. I have that question for Ryan as well.
I think we already looked into this. I think I had this discussion already with HR, if I recall, and with Aaron. I believe that the contract, that the trust here can approve it.
Well, it can, but I think that this is something of this magnitude should be brought in front of the board as well.
And then
in case they have any questions, and this is a new thing after so many years.
Certainly.
I think it would be prudent to do that.
And we leave it to your discretion. Go ahead. That you can certainly do that.
Madam Chairman. Oh, sorry.
Yes, Susie?
Madam Chairman, I think I agree with you. Let's remind ourselves we are just an advisory committee.
Right.
And since this is a contract with Mojave County, I think we could recommend approval, but I think it needs to go back to the Board of Supervisors for their final approval. This is a contract with Mojave County.
Susie, I believe that we do have the legal position to do this. We've gone through up this road before with other things, but I think that the smart thing and the best thing to do was to give our recommendation to the board and or vote on it and let the board make the final absolute decision. I think that is something that they'd want. I know I'd want it, and so I think that's what we should do.
I agree.
How about anyone else?
I agree.
Okay. All right. So if that's the case, while we're on this subject, because I know we have some other questions, so at the end we're supposed to go into an executive session for legal consultation and then come back and vote. Are we going to do that? Are we prepared to do that?
You don't need, it's up to you. You know, I think the course of action that you recommended is prudent. It makes sense, but you will not need to vote on it. If ultimately you're seeking the approval from the Board of Supervisors, then you don't need to make a vote here. Send it to the Board of Supervisors for their approval. Once they give you the authorization, then you sign
Can
it.
we make a motion to advise, to recommend
Sure,
to the
absolutely.
board, because since this, like planning and zoning.
Yes,
we make this
absolutely.
recommendation and then just leave that up to the board, and I'll explain it when time comes.
That's a great
And
idea.
is
It
it
really
anything
is.
we can get on? Is this a time thing for you?
Well, there is, Madam Chair, and that's okay, because I get where you're coming from. The sale's effective on September 1st. Okay?
Right.
So the question would be how the mechanics of that would work if you go to the board, right? If presuming that they agreed, right, how would the motion here be structured so that then it could be executed? Right? Because
right.
that's, otherwise we're going to have to schedule again with this board.
Right, and we have now 2 meetings a week scheduled on the schedule. So what would be the fastest meeting we can get it on?
Madam Chair, realistically, it would be Monday, the 31st.
Okay.
Because by the time this meeting is over and then the posting time constraints, we couldn't do tomorrow.
Yeah, I'm going to be out of town, but I can call in.
Yeah, so it would be Monday, the 31st. We could get it on that special meeting.
Okay, so we could
That works.
feasibly still be in your timeline by the 1st. And again, it's more of a formality. I don't see any problems happening. I think it's going to be talked about at any rate, and so we might as well just do it instead of prolonging it
And
longer.
Madam Chair, that's not a problem. The actual closing is set for the 9th or 10th retro to the
Right.
1st, so that gives you time.
Okay, Susie, does that answer
Madam Chair.
everything?
Yes, but I do have one question. The assignment we're talking about right now is only for the contract up to June, or is this assignment also applies to a contract for next fiscal year? Is this assignment just for this fiscal year we're talking about, ending June 30? Because right now we still have Erin Collins, which is part of this company, and I would assume that by next fiscal year, Erin Collins' name is gone on it. It would just be Gallagher. So would the assignment just for this period, and then we talk about another contract for next fiscal year with Gallagher directly?
I can answer that, Madam Chair. So basically what you're doing is, Susie, is assigning the contract over, which is through June 30. You have a renewal and a cancellation option that comes with it in, I believe it's March or April. So that all comes across. The name will change. I am contractually obligated to stay for not less than 3 years.
Yeah, but contractually it's going to be with Gallagher, not Erin Collins anymore, correct?
Correct. That's correct. Yeah, the company will cease to exist.
Yeah, that's right. So I think what I'm talking about is next fiscal year, the county is actually contracting with a firm called Gallagher, of which you'll be part of, but contractually it is with Gallagher.
Correct.
So would that be a different legal stuff we need to do? I think I'm asking the attorney right now if that's what we need to do.
I don't, if I may, Chairman. So Susie, if I understand your question correctly, you want to know in the next fiscal year with whom we'll be contracting? Is that the question?
No, okay, let me repeat it. For what is in front of us right now, if we recommend to approve the assignment to the Board of Supervisors, then we have documents drawn up with that, which is assigning it to Erin Collins and Associates, a partner of Gallagher, okay? And that would take care of this period. Next fiscal year, Erin Collins as a company is gone,
Correct.
and it will be contracting directly with Gallagher. So that would be another sort of like document which we need to do, because now we're practically contracting with Gallagher directly.
Well, not
So what we're
necessarily.
approving now is only for this period.
Yeah, I mean, not necessarily. You'll have to determine what the contracts stay with the next one. I mean, the assignment is effectively is effectively replacing Erin Collins with the new entity, right? And so the new entity then has that contract. Whatever the current contract is, that will remain in effect for however long it goes. Is it a 3-year contract, Erin? Is that what it is right now?
Correct, yeah.
So that 3-year contract will continue to remain in existence. If next year we bring this back to the EBT for whatever reason, We will be entering into a contract with the new entity, yes, but we still have that 3-year contract. This contract still remains the same. All the conditions remain the same. It's just that instead of it being Aaron Collins, it's the new entity that's going to be handling it. So that it's not going to change that 3-year contract, though. That 3-year contract is still going to remain in effect.
Well, a 3-year contract is with Aaron,
But no,
technically.
it is right
And
now.
starting in September, it's not with Aaron anymore, it's with Gallagher.
Correct. But that 3-year contract's still going to exist. But it's going to be with, instead of it being with between us and Aaron Collins, it's going to be between us and the new entity.
So basically, you're assigning the contract that Aaron has to Gallagher. That's what we're doing, right?
Yes, we are assigning the contract to Gallagher.
Okay.
That's correct.
Okay.
Okay? Verlin?
Thank you, Madam Chair. So I have 2 questions. Number one, you indicate, Aaron, that you'll be leading still for now 3 years, correct? Mm-hmm. And if we don't recommend approval, then we still have you for 3 years?
No, because I am, okay, that's a good question. Nice. Thank you very much. It's actually a very complimentary thing, Verlin. Madam Chair. No, because I am, as part of the sale, I'm contractually obligated as an employee of Gallagher, and then I have to cease any related businesses under my name or my corporate name. So I become a full-time employee of Gallagher, and I cannot do side practices or anything like that. So it has to be Gallagher. And again, I would tell you, guys, I appreciate the conversation. I wanted to reassure you for what it's worth. They bring so much to the table that they will only enhance what we're doing today.
Madam Chair, if I could follow up, I think Verlin raises an interesting question. If that were to happen, if the board chose not to go with it, I think then we would have to discuss with Aaron Collins and Associates the termination clause, and we would have to look at a new provider.
That's correct.
I mean, it's mandatory. I mean, we would have to look at what those provisions call for, and I'd be happy to review those. But the board should be aware of that. I mean, you want to know all your options. All things are on the table, and so I think that's a legitimate, good question to ask. So.
I like the idea of the 3-year contract that keeps this process that we have grown accustomed to in place with you as the leader of the organization. Gives it, I think, adequate time to make sure that the board is happy with the information.
Yeah, Madam Chair, to adjust Roger's issue on the term, what it really does, the 3 years, really, frankly, caps us, because it guarantees that we can't change rates or any of that. You still retain the option to non-renew the contract at every fiscal year. So it's really a protection for the trust.
Any other questions?
I have one more.
Okay.
So can they change the contract in those 3 years?
They cannot.
Or Gallagher's also locked in as we are?
That's why Madam Chair, the question is, can they change the contract? The answer is no, and that's why we're doing the assignment for Berlin, because it flips that contract over intact.
Okay, so, but we can cancel it after June 30th,
You cancel it in the spring
correct?
for July 1,
Right.
and you retain that right in each of the next 2 renewals.
And do they retain that right as well?
Both sides do. And that's what Ryan's talking about. Again, I'm traipsing here, but there's a agreed termination.
Yeah, if I may answer that, it's as if, just take the contract, just take the exact contract, however many pages of it, 20-something pages that we currently have, and just erase Aaron Collins or put Aaron Collins and Gallagher, whatever the new names, and that's what you're doing. I mean, there's a whole lot of legal stuff to it, but just picture that that's what you're doing. The contract is exactly the same, so whatever terms and conditions are today, they will be tomorrow, the next day, after the assignment as well. It's just that instead of it being just Aaron Collins and Associates, it is Aaron Collins, a company of Gallagher, whatever it may be. So they're bound by the same terms and conditions that we will be bound by the same terms and conditions. The exact same things will be at play.
Any other questions? No. You keep talking about these benefit suite of additional products. Don't need to know all of them, but what does that mean?
Well, on the benefits side, right, they've got, again, as Scott mentioned, they've got a suite of attorneys that we can call to do additional research. They've got ongoing support information we can download, for example, on COVID, on practices, best practices that you can use. Enrollment portal support. They've got a specialty unit that does PBM RFPs. I mean, it's just a laundry list, and Scott can go into more.
And all of the vendors that are in that contract, that's still, there's nothing going to change with that?
No, the only thing that changes is the name, as Ryan's saying, the only thing that changes literally is the name. Let's put a caveat on that. We're only as good as the last heartbeat. Right, so if you have the human changes, turnover, and that kind of thing, but all the contractual provisions remain identical, and that's why we chose the contract assignment vehicle, because we knew people were going to be uncomfortable with change. So that's reassuring them that the contractual services come across, and the same thing with the team. That's why no one's changing on the team.
Okay. Anything else?
No.
Okay, so what we have to do now is, does anybody want to go into executive session to ask our lawyers anything specific?
No.
No. Susie?
No.
Okay. So we need a motion to, I believe, make a recommendation to the Board of Supervisors to accept, let's see, recommendation to the board to assign ECA's contract with the trust to Gallagher effective September 1st, 2020, and to authorize Ken Cunningham to work with counsel to execute any amendments or other paperwork necessary to do so.
Madam Chair, I'll make that motion.
I'll second that motion.
We have a motion and a second. All in favor?
Aye.
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 Opposed? Motion carries. And we'll make sure that that gets on in the next possible meeting.
Are we done with that one, Madam Chair?
We're done.
Okay, so the next one, I'm going to turn it over to Missy to do the wellness update.
Thank you. Good morning, Madam Chair and trustees. I appreciate you giving me the opportunity to talk through just a quick update on the wellness program for Mojave County members. So as far as the health risk assessment, I just wanted to let you know that although these screenings were all canceled, they were originally scheduled in March. We did cancel these due to the pandemic. And I wanted to just let trustees know that there were no cancellation fees assessed for canceling the screening. And then we actually updated future contracts to include a provision basically that protects the trust in situations like this, so there are no cancellation fees. So I just wanted to update everybody on that. Worked with legal counsel on ensuring that that update was made into effect in future contracts as well, so that the trust is protected. As far as the skin cancer screenings, a brief update.
Gregory
has left the conference.
So as far as the skin cancer screening, we did see a decrease in some of the screenings and a pretty significant increase actually in Lake Havasu, which was pretty fantastic to see. This screening was originally scheduled earlier in the spring, and then we postponed and rescheduled it for later. So I think that really had an impact on the decreased participation we saw, because honestly, Jade does such a fantastic job at communicating all of the screenings. She does such a wonderful job incorporating this into her emails and sending out all of the reminders. So I think the decrease is really related to that cancellation and rescheduling, and then also the limit to the number of members that can be screened per hour by this specific vendor because of their enhanced screening protocols between members.
Excuse me, Missy, can you speak a little slower? I'm having kind of a hard time understanding you.
Yeah, absolutely. I apologize for that. I have a habit of speaking too fast. Usually Aaron gives me the eye and I slow down. So as far as the cardiac and organ screening, just a brief overview on the participation overall. We did see an increase in this screening. This is definitely one of the most favorite screenings, I would say. Unfortunately, I don't have any participation, or I don't have any abnormal statistics to be able to share with you at this point in time. But once I do have that information, I will certainly share that with the Wellness Committee and then with trustees at a future meeting, just to give you an idea of any anomalies that were experienced with this screening. As far as the Healthy Heart blood draw, so this screening is actually taking place this week. Overall signups were looking really good. We had to actually extend some of the screening timeframes to accommodate signups. This was also due to decreasing the number of participants that are screened within a certain time frame, again, to help with social distancing and the cleaning protocols. We'll have an update for the Wellness Committee at the next meeting, essentially walking through the participation stats and then also any anomalies that were identified from this blood draw. The POP screening, or the Prostate On-Site project, is the comprehensive men's health screening, and this is shared actually with any EBT. So the cities, Kingman, Havasu, and Bullhead, so that way it eliminates any risk for meeting minimums and things like that. And below is the schedule for your review. We're actively communicating and continuing to promote signups and things like that for this shared screening. Mammography screenings are being held by Simon Med Imaging, and those are taking place at the end of this month. We are in the process of working through the contract with Simon Med. We had legal add additional protections in there for members out of the request of the EBT, and so we're just waiting on Simon Med to be able to come back with their approval. I'm hoping to have additional information and the contract signed soon on that, and then we'll be able to actively start marketing that screening to members. Additionally, NAEBT does share their Bullhead and Lake Havasu screenings with Mojave County members, since we're not able to have a Mojave County screening specifically. So those will take place in November, and we'll certainly work with the Wellness Committee and Jade on getting the marketing materials out for that. Flu and pneumonia vaccinations, we have the schedule of those taking place for the 3 major locations. As far as the dental cleaning campaign, as a reminder, the trust voted in favor of adding this campaign, which essentially helps to increase preventive cleaning utilization. This is a quarterly marketing campaign, and we launched it July 1. It will continue through September 30th, and a drawing will be scheduled for October for anybody that had a preventive dental cleaning during that time frame. Delta Dental will be facilitating that and distribute the electric toothbrush. The next campaign then will run October through December, with a drawing being held in January. And ECA will plan to work with Delta Dental to basically determine if the campaign has had a positive effect and increased utilization of preventive cleaning. And we'll do this at the 1-year mark. As far as Walker Tracker, as a reminder, this is the activity portal that has destination step challenges that encourages exercise within the population, helping to reduce risk factors for heart disease and diabetes. To date, we have 278 participants registered. The table on this page highlights the challenges from the previous fiscal year, the step goal, and other relevant information regarding that specific challenge, including average daily steps. On the next page, it actually highlights how many were able to meet those goals, what was the actual average step count compared to the average step goal. I can see that Mojave County members seem to enjoy the turkey trot, which was actually a team-based challenge, so we'll continue moving forward with that challenge. And then we'll also utilize the prior year's step goals and that for moving forward to ensure that we have an appropriate step goal for participating members. And you can see the schedule of upcoming challenges for this fiscal year. A quick update on Livongo for diabetes. So again, this was introduced in July of 2018. Membership has remained steady, although we have had some new ads and then some who terminated from the program for various reasons. It could have been that they were no longer covered on the plan or chose to terminate the program early, but we're seeing a consistent number here, which is great to see. We'll continue to market this and work with Mojave County HR and also the Wellness Committee to continue to promote it throughout the year, along with doing direct mailers, and then also included at open enrollment and at new employee orientation. And then lastly, the Employee Wellness Needs and Interest Survey. We are facilitating this in October in collaboration with the Wellness Committee to assess overall level of satisfaction with the wellness program, look at areas of interest, and then also preferred mode of communication. And this survey will also include a specific question related to the expansion of Livongo, as trustees have requested, to get feedback on whether these kinds of programs would be interest to employees. And so as a reminder, that specific program included hypertension, a diabetes prevention program, and weight management. So these are the specific things that we'll be asking members to weigh in on, and we'll be able to share the results from it at a future trust meeting, and then we'll also work with the Wellness Committee using these results to continue to administer programs for Mojave County members. I'm happy to answer any questions you might have.
Okay, any questions for Missy?
Chairman,
Yes.
have a question on the flu and pneumonia vaccines. National news has really been pushing the vaccines, saying that they're available now and that the country needs to get started on getting the vaccines done. Has there been any discussions with that at the county level? I notice a date that's on here is at the end of October.
So, Madam Chair, Roger, I think, and Missy, I think this question's for you or maybe for Ken. Has there been any, I think what you're asking, Roger, is has there been any discussion of moving that up earlier?
Yes.
Okay. No. Missy? Jake?
I have not received any requests from the county, but certainly can work with the HR to verify if we can do that, and also the vendors. I'm happy to do that if that's requested.
We'll look into it. Okay. It's the first time the question has been posed, Roger, Madam Chair, so we'll look into that.
Okay.
I'm moving it up.
Thank you.
Any other questions?
I note that we have to add dates frequently. Is it possible that people don't sign up because they've called, tried to get an appointment, the appointments were filled, and didn't bother to bug Jade or somebody else to try and get dates added? That's my first question. And my second question, and Missy, you may have said this, but I, like the chairman, was having a little bit of hard time hearing you. Did you say the mammograms are in November?
I have the schedule listed. So these are the end of September for Mojave County and Kingman. And the cities, Bullhead and Havasu, have their screening scheduled for November. And so we'll absolutely market those as it gets closer to that time. About 6 weeks prior, we'll send out the flyers.
So the Mojave dates in Kingman are in September. Okay.
And then to answer your other question, your first question about dates, I've not had any feedback as far as people not being able to schedule should something be full. I think people have been reaching out to Jade, or as far as I know, whenever a schedule is full, either the vendor will notify us to reach out to Jade to verify if we can add or extend. Otherwise, employees have been going directly to Jade, and then I go to the vendor to verify if they can also extend. I'm not sure how many might not have been able to schedule who didn't come forward.
All right, Madam Chair, Verlin, are you thinking there's going to be a rush this year? Is that what you're thinking?
Well, I think in the past it has been. I know at least on 2 of these occasions, when I tried to call, the appointments were full. Mm-hmm. And I read my emails pretty timely. And both times I called Jade and dates were added to it. But I'm just wondering if, there's 30 other employees out there who, called, couldn't get a date, and, just that was the end of it.
Missy, do you know
And
off the
if-
cuff, is this one, do we have minimums on this one?
Specifically the flu and pneumonia?
Right.
Yes, there are minimums.
Okay, so I'm thinking, and Verlon, I'm thinking we can do that as a takeaway on two parts. One is checking the dates, and then two is checking the number. What I'm thinking is we can look at past usage to see if we hit our minimums, because generally we drive the time based on trying to avoid paying minimums for no-shows. So what we can do is look back and see if that was an issue in the past or not. And then adjust. We can get with Ken and Jade and adjust on both points as needed. Because do you get the minimum thing?
Yes.
Okay, all right. So we're always squeezing that, so we're not paying for things the county doesn't use or the trust doesn't use, but we'll take a look on both of those.
Do you think there was a lot of people who didn't participate this year just because of the pandemic and didn't want to expose themselves? They weren't at work, had kids at home, couldn't participate or whatever. Any idea, is there any studies of maybe how many people just didn't participate this year?
No idea. Honestly, I have no idea. What I was thinking when Roger was talking, and then when you asked the question later, I'm thinking we might, and maybe we need, again, we'll see, maybe we need to recalculate and risk more minimum just to make sure people have the opportunity, because I think, and I hadn't thought about this before, but maybe there will be a higher volume this year because there's such warnings about not getting flu and COVID at the same time. So we'll recalculate that and work with Ken and Jade and see what that translates into.
Susie, do you have any questions? Susie?
No question, ma'am.
Okay, I have a couple of comments. So I had this conversation with county manager. My office is getting some feedback that one of the reasons that some people don't sign up for these things, some departments make these employees take PTO. And I don't know, I haven't spoken to any departments. Is that true? Is that true? Okay. So I think it would be a good investment for the county to make a policy that if you do these preventative tests, that you can do it on time, you don't have to take PTO. We talked about that.
Good morning, Madam Chair. Yes, absolutely, we did. My understanding is it's really not consistent. It's different in different departments. So what we would need to do, given the desire to ensure the highest participation, is to be consistent as far as what you just stated, which is for these purposes, for preventative testing and or vaccination, you're allowed a certain amount of time to sign up and then get it done. And that I'd be more than happy to follow through on to ensure that we are consistent.
I think we need a
throughout.
countywide policy on that, and I think it's a good investment. The prostate project, I mean, historically, we don't get a lot of people signed up for that because a lot of the public works, a lot of the males. Do we take into consideration those kind of schedules? Do we make allowances for road workers? Or is it just, this is the time we have, and if you can't do it, you can't do it?
Madam Chair, my understanding is it is done to accommodate the schedules, and for example, Public Works, as you pointed out, they provide an earlier window starting at 6 a.m. to accommodate that, but I'm also going to defer to Ken to add any additional information. That is my understanding. Those that work out in the field and start earlier have an earlier window of time to do so.
And we've talked in the years gone by, some kind of incentive to have these men understand how important it is. I mean, no one wants it, I know. Just like we don't really like our mammograms, but how important it is. And
Has joined the conference.
So, Madam Chair, as you know, department heads and I meet every Tuesday at 9 a.m. 2 weeks ago, I took the time at the beginning of the meeting to remind everyone in the room that we have these opportunities, preventative testing, available, encouraged each and every one of them to prevail themselves of those, as well as encourage their departments to do so. And I'll be happy to, and I do plan to do so every other week, just to keep it, especially during this fall time as we approach, because it seems like this is when we do a lot of those tests and the vaccination.
Okay. Does HR have any recommendations on that?
Yes, ma'am. I just wanted to clarify just a couple about the PTO issue. When Mike was here, he told the directors there will no be PTO.
I can't hear you.
Sorry. When Mike was here, he did direct the directors that they would not be using PTO for our wellness items, but he could only advise some of the elected officials, and that's where some of our issues came from, was some of the elected official departments.
Got it.
Has joined the conference.
Okay.
And then with the road workers, the schedule was set up around them, and since that's the highest concentration, that's why it was set out at the facility, the Public Works facility.
We've spoken about incentives in the past. Has anyone come up with anything, or?
We haven't, given, you mean like a bonus or a gift
I don't
or
know.
something like that?
We're hoping for some.
We just have to be very careful about gifting them the money, but we can look into some sort of an incentive.
Okay. All right, well, that's good. I think we should have an overall county policy, and it sounds like you're on the job on that one, and I think that will help people and encourage them to go get tested. So is there any action on this?
No, it's just a report, Madam Chair, unless you wanted to give specific directions. No.
Nope.
Nothing. Okay.
Fine. Anyone else have any questions about the wellness? Okay.
Madam Chair, I'm sorry, could we go back to number 3, the discussion of the acquisition of Gallagher? I just want to clarify the legality here, just real quick.
Okay, can we finish this one up? Because we're
I
at the
thought we were
end.
done with wellness. We're not done with wellness?
I can't hear you.
We're not done with wellness?
I don't know. Are we done with wellness? Aaron?
Yes, ma'am. That's
Okay,
it.
all
We have
right,
nothing.
we're done with wellness. Okay.
Thank you. So I was able to revisit, Aaron had already asked me this question about who needs to vote on it and so on. Previously, I found that email, and I was just kind of refresh my memory as to what I determined. And this is what I wrote. The EBT Board of Trustees has the authority to approve the assignment. I just wanted to clarify, you do have that authority. Yeah. The EBT Board of Trustees approve, deny vendors. We do that all the time. We're doing that today. And approving the assignment is akin to approving, denying the vendor. Further, the ECA Wellness Services Agreement is between the ECA and the EBT Trust. It makes sense that it would be the EBT Board of Trustees that would approve the assignment. Finally, the trust declaration gives the EBT trustees the absolute and exclusive control over the management and conduct of the business affairs of the trust, free from any power or control on the part of any department, employee, elected official, or other third party. So they could do it, but I think your recommendation is wise, to send it to the Board of Supervisors for their approval, consideration, because if they didn't want it, then most likely you guys probably would not want to do it either. I mean, you would be doing it at your own risk. But I just want to clarify that legal part.
Yeah, I think it's the most logical thing to do, courtesy and respect, and this is a big change, that we've had the same thing going for years, and this is a change that I don't think an appointed board should make the final decision on.
So I just want to make sure all the board members were aware of that. Thank you.
All right, anyone else before we move on?
Okay, so Madam Chair, the next one is the budget. I was thinking I should read every paragraph and letter that's in this to you, but it might kill me. So what we're doing here, it's kind of like when the Board of Supervisors adopts a tentative budget and then does a final, because we do it in February or March, and we're including projections for things like stop loss in there. So this is really formalizing everything. The key items are the rates that are charged are not changing, okay? But what this does is relists through all the benefit changes. We've got a clear record in here. The two that I would call out, on the third page, there's a note on reinsurance and a note on vision. And I'll hit both of those in a couple of times, different ways. But reinsurance, you're going to see really the biggest change in here is reinsurance. We projected 25% for the county based on what large cases we had. COVID was not even in our picture, but frankly, it came in really good. So we wound up with about $223,000 under budget in that line item. We came in at less than 6% overall. So that 223 goes down into the general admin item, and it becomes the general admin operates like a contingency line item. So it gives us money during the year if something surprising happens. Just call that one out. You're going to approve the reinsurance later. And then on the Vision is a voluntary employee program. It's not included under the trust, but we did the notice to employees with great fanfare that costs were not going up, and then in April, the Vision increase came through for those who carry it at about 7%.
Cliff Marshall has joined the conference.
And it worked out at about $7,700. So I believe staff worked with the chair and authorized it to absorb that increase from an employee relations perspective. So I wanted to call that out, that we were going to eat that out of the contingency. But then frankly, we've got $223,000 under budget, so it's not even close to a wash. And then I'll work with staff to make sure that those renewals come up in an alignment. Frankly, we just forgot about them. So we'll get them aligned so that we get the renewals at the same time we get them done, so we don't get surprised anymore. And just on that Vision renewal, just as an inference, it was a 5-year rate guarantee that expired. That's how it fell off the end of the table. They did 7% and then gave us 4 more years after that. So again, just one that, because it comes up so infrequently, we got surprised by it. But I'll be happy to answer any questions specifically on the budget, the rates, anything that we did with that, Madam Chair.
Any questions?
Madam Chairman?
Yes.
Madam Chairman? Yes, Susie. I don't know if I should raise this question in this item, or in looking at the agenda, there was an item on the hearing plan. And I understand that that item on the hearing plan is regarding somebody else's request, but my understanding, Aaron, is that we dropped off the hearing plan aid because our provider, which is Blue Cross, wasn't meeting their contractual obligations, and we never put it back later. So is there any desire to include this as part of our benefit package? Rather than making an exception, is it going to be part of a benefit package for the employees to put it back because it was part of their benefit before?
And Madam Chair, that item is, and Susie, that's a separate item that we're going to get to and address and go through that conversation. If you were to do that, if you were to direct me to work with the actuary, what we would do is go back, reprice it, come back, give you a target date and a cost to do it.
Okay, I just raised this because it has a fiscal impact of adding another benefit to the employees.
And we do not have numbers for that today. So again, if you make that direction to go back and price it, then we will do it.
Okay, all right, thank you.
Okay.
Anything else, Susie?
No more, ma'am.
Thank you. Anyone else? Okay.
Okay, Madam Chair, I'm sorry, we do need a vote on that one.
Okay, I need a motion to accept the final budget.
Move to approve the final MCEBT 2020-2021 budget as presented.
I have a motion second. All in favor?
Aye.
Aye.
Opposed? Motion carries.
Okay, the next item, Madam Chair, is the IBNR. Without belaboring this, just the significance. There's a lot of this stuff looks bureaucratic, and what we say internal to ECA is it's boring until it's not, and the goal is to keep it boring, okay? But this one is a very good illustration of how having a self-funded plan crosses over into the county's obligations as well. So the IBNR is basically an estimate of the dollar value of claims that are outstanding that have not been paid, plus an administrative component that only comes into play if the trust shuts down. Okay, not foreseen, but you got to post a full liability. Where this bridges the gap is when Coral and her folks are going in and doing the CAFR and the budget and the audits and all those kinds of things, they have to declare all the liabilities and the assets of the county, and the trust is a liability on the general fund by law. So if this thing ever gets in trouble, you have to go to the general fund. That's the only place you can go. You can't go back to employees, and you also can't go back, I believe, and surcharge your special funds, your non-general funds like the HERF funds and whatnot. So it really is a big exposure to the county if it's not managed well. So what this one does is gives you that independent actuarial certification that says your IBNR is X, and then it's just math, how much cash do you have on hand. So this one, again, fairly perfunctory, but I wanted to make sure you understood it's not just bureaucracy. This one goes into the county, it goes into bond ratings, it factors into quite a lot of things in terms of booking liabilities and assets. Chris is on the phone. Do you have any questions on the methodology? And I'll be happy to answer any as well.
Any questions? Roger?
I think I do have a question. I was just curious, so the experience that we see in this item, is that pretty much industry standards? I mean, should we be concerned over this experience that we're having? Is that different than anybody else's, or is this just a standard order of business?
Madam Chair, Roger, I'm going to knock wood, okay, and say in all sincerity, this county trust is the single most financially solvent of our clients in the state of Arizona. The results are exceptional. And that does not come by accident. What you're seeing is the trust, and if you look at the packet, you look at the way you guys conduct business, you're in the detail, which meets the fiduciary obligation that you have to be in the weeds on the trust to make sure you're managing it correctly. But that, over the last 20 years, has taken this from a very fiscally fragile trust to a very solvent one with very competitive benefits. So, and that's the summary. You're in really good shape.
Thank you.
Okay.
Berlin?
Was there any savings because of the pandemic and things that were offered for free to the employees or the general public?
Two separate questions. Okay, so the questions, one, was there any savings from the pandemic, and two, from the screenings. Is that right? Okay. On the pandemic, it's hard to tell. We've got about $100,000 spent on claims, and Rick's on the phone from Meritain. He can kind of go into that related to the pandemic. What we're seeing, and I believe it's happening here too, it's kind of by guess and by gosh, Berlin, is there was a huge delay starting in March on non-emergent surgical, anything hospital-based. So we actually saw as all the claims dropped because the COVID cases hadn't come in. What we believe is happening, and that, including with Mojave, is that those cases will move into next plan year. Okay, so as everybody gets the disease transmission things figured out, they'll put them in, because if you need a hip replaced, it's not going to get healed. So they're just going to move that in the next year. So I believe we've seen an unusual dip, okay, and that's part of the reason we perform so well. Everything else is normal. The cancer cases, the cardiacs, the emergent stuff, all pretty much the same. On the wellness, it's always going to be hard to tell to prove what didn't happen. But anytime you find an early stage prostate cancer, cardiac cancer, prostate cancer, breast cancer, or cardiac issue, the standard trajectory is the medical outcome is improved and the cost goes down. Okay, so it is conjecture. Beyond that, there is a counter argument to wellness on two fronts. One is that with those same screenings, that the false positives may lead to additional levels of care. And secondly, that in some cases, had you not found it, they would have died faster and cost less. And I know how terrible that sounds, but that's the hard reality that you're weighing. Overall, I believe, and Chris can comment as he wishes on this, but overall I believe that what you'll see as time, because we've seen it with our clients, is the things you screen for decrease in your large case reports. One of my county groups, breast cancer, that's how we got into it. Breast cancer was number one for them. Frequency of diagnosis and dollars spent. 5 years after implementing just a mammography, it went to number 9. It has never gotten above 6. So it's the absence. Can you prove it? I believe it's common sense at some level, or intuitive might be a better word, that the higher you're testing for a particular disease and the less frequently it appears, there's an indication there.
Madam Chairman.
Berlin is not finished yet.
Do we need to expect, I don't know anything about COVID, but I understand that the federal government picked up some of those bills, but I also, there's certainly at least speculation out there that anyone who had COVID may be looking at substantial other issues in the future. Do we need to plan for those, or is there a way to even do so?
I'm going to defer that one to Chris, the actuary, because I don't have the answer to how it's going to progress. Chris, so the question was basically follow-on or continuing deficits, continuing medical treatment arising from COVID. Is that something that you're in a position, or you think you'll be in a position by the time we do rate making for next year to factor in, or any thoughts on it in general?
Yeah, so this would be for the rates. I just want to be clear, not actually for the reserve, the IBNR. But there has been much discussion, and there is a difference of opinion as to how much that's going to cost going forward. I've seen estimates anywhere from actually there being a cost decrease next year overall to increases close to 10%. Now, when I say next year, I mean, I'm talking about calendar years. I know you guys are on a fiscal year, so that's different than that. So that would be a little bit, probably half that, just given the timing. But right now, there's no real consensus, and there's still a lot of analysis being done. I mean, I get different estimates from different carriers right now, and then we have our own modeling. But we'll be in a better position to tell by the next time we start doing the rating here in probably another 5 or 6 months, that's for sure. But we're not looking at anything like double the costs or anything drastic like that at this time. It's probably going to be a couple few percent, I would imagine, because there will be some savings just because of deferred care and people still not going to get all the elective services that they would normally get. And then, of course, that would be offset by these increased conditions that people that have COVID have. But basically, we don't know for sure, but we think it's going to be a small amount. So.
Okay.
Madam Chairman?
Yes.
Yes, I have a question for Erin. How long do we actually carry the IBNR liability? And the reason I'm asking this is some providers, some of them, not all of them, sometimes forget to bill. I mean, it's incurred, but they don't bill. And I think they have a year to bill, right? So how long do we carry the IBNR liability funds?
That's a good question. Madam Chair, Susie, the IBNR never goes away. It's recalculated every year, and it's based, it takes into consideration the fact they do have 12 months to submit those claims, but it also looks at Meritain and the dental carriers, the lag report. So basically, Chris runs in his chart, and he can speak to this probably better than I can, right, much better than I can. But in essence, they look at that ongoing shifting of what's the dollar value that we know is out there based on the prior lag in the dates from incurred to date paid. So it's never going to go away. Okay. It's just going to be estimated each year.
Okay. Thank you.
Okay. Anything, Roger?
No.
No questions? Okay.
Motion?
Mm-hmm.
Do we need
to accept this?
Correct.
Okay, so I need a motion.
Move to approve the 2019-2020 incurred but not paid as presented.
Second.
Okay, we have a motion and second. All in favor?
Aye.
Opposed? Motion carries. Number 7.
Okay, Madam Chair, this is the surplus reserve recommendation, and with this, so the IBNR is the minimum. You got to have that covered. Then, in addition, the trust has established a goal in previous years to carry a surplus reserve, and frankly, that is for things like pandemics or just a bunch of claims, and they happen. The standard that's been used in this trust has been IBNR plus 6 months. And then what has happened in the past is occasionally there's been a discussion between the Board of Supervisors and the trust about whether or not the trust wishes to release any amounts in excess of the surplus reserve. So all we're doing here today is basically saying to you, in the past we've adopted 6 months, IBNR plus 6 months. That's being recommended again. And if you look on page 3 of Chris's, page 3 in the packet, it's the first letter of Chris's letter. He's recommending the 1.582 is the IBNR, and then a contingency reserve of 5.8 million for essentially for 7.4. What will happen after this, depending what number you guys pick, if anything, is then we will speak with Coral, we'll get our books all aligned, and then she would come up with a number for you that says if you wanted to then do a premium holiday with the board, here's how much is available. I'll be happy to answer any questions, Madam Chair, or Chris Ken is the actuary.
Any questions?
I have a question, Madam Chairman.
Go ahead.
Since I'm new in the board, is it my turn?
Susie?
Hello?
Hello?
Yes. Since I'm new to the board, I'm here. Can you hear me?
Yeah, if you can speak up just a little louder.
Okay. Since I'm new to the board, I wanted to ask if we have a surplus in the trust budget, what happens to the surplus? Do we actually give it up to the county for general budget purposes?
I'll answer that just by our history here. That's up to the county. Since I've been on board, which is going on 8 years, the only time we've used some of the surplus was when we needed some money for economic development. And then what happened is we did a holiday, right?
Correct.
We can't just take money from it.
Correct.
So, yeah, you probably could have answered this better.
So, Susie, Madam Chair, and trustees, so it's essentially the money coming into the trust is a one-way valve. It's two sources other than investment income is the county contributions and employee contributions. They come out.
Correct.
They come out pre-tax. So that introduces an Internal Revenue Service issue because of what you can and cannot do to them. In addition, the state statute says the only way a county can, and it's by the language of the trust, really the only way the county can get access to money that's already in the trust is to shut it down. So if you shut it down, then by law, it can only go back to the general fund. So Susie, to answer your question, we cannot write a check from the trust to the Board of Supervisors or to the general fund. What happens instead is once we exceed whatever thresholds are adopted in terms of the fund balance, is the county can withhold contributions so they never make it into the trust. And that's called a premium holiday.
Okay. Yeah, I remember that.
Okay. And what we're doing here, because you are new, so what we're doing here is saying cover the IBNR, recommending 6 months of additional contributions, basically to cover the swings in claims that we see them all the time. It's just the nature of it. IBNR is the minimum. This gives you some financial cushion so we don't penetrate the IBNR or have to come back to the county for supplemental appropriation. So it's basically the cushion. And then any amounts in excess of that have historically been made available as premium holiday amounts if the county wanted them.
Right, but I think we've only done that once since I've been.
It was authorized twice, it was only taken once.
Right, and what is the surplus right now?
I'm not sure.
That's a lot. That's as high as it's been since I've been there. So that is a discussion for the board. Whether we give it back to employees or whatever we talk about. But that's a very healthy.
Very good.
Because I just remember from my first meeting that our actuary recommendation of whatever it is, 7.4, is very conservative. So
correct.
It's
6 months of contributions.
Right, but because of COVID, it's probably just best just to leave it there. You never know. We don't know what's going to happen in the future. So I feel confident that we're going to be fine.
And Chris does that, Madam Chair. Chris does 6 months. What we do is there's an aggregate stop loss out there. And what we do internally is say, and those are bad. If that thing ever attaches, the world's coming to an end. And what we use as our thumbnail is, can you take 2 attachment points year to year? And coincidentally, it works out right at his number. So you're in a really good place. And frankly, that you could see that happen in this scenario where you have COVID overlaid on top of the normal cancers and cardiacs and car wrecks and whatnot. So it doesn't happen often, but it's not outside. We do have an account right now that's in the second back-to-back year. And I've seen that once or twice in the last 28 years.
Okay. Any other questions?
As usual. I know that this number does not include the 10% for the unknown COVID or whatever else. Why would we not want to do that?
Going back to Chris's thing, just because it's an unknown yet, Berlin, and I think as the
Right.
data comes in,
That's one of the things that Chris recommended, although it's not included in our figures, is my understanding, that, well, here's this quote: "While we did not make an adjustment to our calculations for the COVID pandemic, the trust should consider adding a margin of an additional 10% to these estimates, given the uncertainty surrounding the issue." Why would we not include that? Because it's so uncertain.
that's a good, you could do it. I don't know if, Chris, you want to comment on that extra 10, but you could take it. You could add another 800,000 or 750,000 on top for the conversations with the board and still leave 2.5 million available for availability for the board. And frankly, from my perspective, what I would just, as candidly as I can say this, you know, you guys get in trouble when things go bad. No one ever pats you on the back when they go right. So there's always an incentive to be more conservative.
Correct. And we do know that many people have put things off, so next year it could be a lot worse.
That's a conversation you could have.
With or without COVID, just because of, you know, elective surgeries or whatever.
Right, and this is Chris Marshall, the actuary. I mean, it goes back to what I was saying before. We just don't know for sure yet. So when it's unknown, as Aaron alluded to, we tend to err on the side of conservatism, with, you know, have caution. So that's why we're recommending that you at least consider padding it by an additional 10%, and that's kind of at your discretion for what kind of risk you're willing to take with it. So in any normal given year, that wouldn't be necessary, but of course 2020 is not a normal year. So that it's just kind of a recommendation that we make, and then each organization decides based on their own comfort level whether or not to implement all or half or none of that. So for what it's worth, not many people organizations have been implementing it. I don't know. I would certainly include it if it was me, but you know, it depends on each organization's assessment of risk.
Can I ask a follow-up to that? What does that really mean? I mean, we have the money. It's not like we don't have the money. So if we did go over or something happened, we have it. So what's the difference between putting it into that number or just leaving it the way it is?
I think it would only come into play, Madam Chair, if the county, if in the conversation of the county and the trust, the county said, hey, we would like some of that cash. So if you lose the $10 million figure, we would do is add another $750 on top of this to reduce the amount that was available to the county to take on a premium holiday. So operationally, it's pretty easy to consider in the conversations with Coral and with Sam.
Okay. So historically, this county, you know, there was that one time specific thing, but we don't entertain that. But if you feel comfortable, would feel more comfortable, then if you make a motion, we can do that. Anyone else has comments on that? If you wanted to do that and just err on the side of caution, make sure that money's there and that the county couldn't take it.
I would make a motion to increase that number by the 10%, just
The surplus reserve amount by 10%, so about 750,000.
Okay.
close enough.
Okay, I'll second that.
Okay, so we have a motion. Everyone understand? Susie, do you have anything to say before we vote?
No, I'm okay.
Okay, so we have a motion and second. All in favor?
Aye.
Opposed? Motion carries. Thank you.
And just so I can make sure I'm clear, you've approved the recommended surplus, but also added an additional 10%.
Right.
Is that correct? Okay.
Thank you. Anything else before we move on?
Not from here, Madam Chair.
Okay. Thank you, Verlin.
Okay, Madam Chair, the next one is just basically a request for permission to work with staff to review the trust document. This has actually come on and off the agenda for a number of years. The trust document that's in effect today was done in July 1 of 1990 To my knowledge, it has never been gone through and just done a cleanup on it. I can tell you it's a pretty cumbersome document in terms of, it does some things like naming titles and things like that. It also has not been reviewed, to my knowledge, for updates, any changes in the statutory authority or other statutes that might impact it. So we wanted to come to the trustees and say, hey, are you guys okay if we get with Ryan, get with staff, and kind of come through, do a recommendation, and come back to you with, the way it would work is we come back to you with, hey, here's the recommendations that we're making, and then assuming you signed off, then you would have to send it back to the Board of Supervisors.
Has left the conference.
Because they are the only one, you are a creature of the board, so they would have to approve the amendments, any proposed changes that came forward. I will tell you that I do not envision any material changes in terms of structure or anything like that. Personally, I think the structure works fairly well, but it's just kind of a messy document, and it's 30 years old. So I think it's about time.
Again, since I've been here. Yeah, Susie?
Yeah, I had a chance to get a copy of that last year from Ken, and I think this is the right time to do it. There's some reference to some departments that should be doing some stuff, and some of those departments are not doing it anymore. So I think I like to see this done, a review and update of our trust document.
Okay. Do you want to put that into a motion?
Yes. I move to direct HR staff to work with our attorney and ECA to review and make suggested changes to the EBT trust document for consideration by the trustees before forwarding it to the Board of Supervisors for consideration.
Second.
Okay, we got a motion and a second. All in favor?
Aye.
Aye.
Opposed? Motion carries. Number 9.
Okay, Madam Chair, again, kind of an admin item. Every year we update the risk management plan. I told Sam during a meeting, and I've said this to others before, this is the least read but probably the most valuable document in the trust outside of the trust document. It's essentially the business plan for the year. I highlight the items that we've proposed to work on in the current year. It's all, again, pretty straightforward. The ship of state sails well in calm waters, and we'd like to keep it that way. So I'd be happy to answer any questions or add or delete any projects. And other than that, it does take a motion once you're done, Madam Chair.
Okay. Any questions about the plan of risk management?
No, it looks good.
Yeah, looks good. How about you, Verlaine? Susie?
No, I don't have any question, but I support all the projects listed.
I didn't get that. Susie, can you repeat that?
Oh, I just said I don't have any question, and I support all the projects as listed in the risk management plan.
Okay, great. Then let's have a motion.
Move to approve the 2021 risk management plan as presented with any additional requests outlined by trustees and/or county staff.
Motion and second. All in favor?
Aye.
Opposed? Okay, motion carries. Number 10.
Okay, Madam Chair, this is the reinsurance renewal. Just as a refresher, every year the trust authorizes Ken to work with us once we go out and negotiate the stop loss. It tends to happen towards the end of the year, so it's, as you get closer to June 30th. This year, again, knock wood, we budgeted 25% based on the large case history, some of the claims cratered. So we wound up coming in at 5.64, about a $223,000 savings over budget. It's a great number. I'm glad to do it. I hope you remember this when it goes the other way someday and we have it come in high. But I would ask that the chair affirm or approve Ken's action binding the coverage effective July 1st as presented.
Okay. Any questions? Susie?
No question, ma'am.
Okay. I need a motion.
Motion to retroactively approve the 2020 and 2021 stop-loss contract with Sun Life as presented.
Second.
Motion and second. All in favor?
Aye.
Aye.
Opposed? It's carried. 11.
Okay, Madam Chair, this is basically a retroactive approval again of the extension of the COVID-related benefit changes. And what this is really directed at testing. So what it does is it waives the cost of testing. It also waives the cost of telemedicine outside of Teladoc where people can't get into a doctor's office. So it allows for those charges to be continued. what I would expect, we're doing this in 3 months at a time, but what I would expect is this will probably go through the end of the fiscal year. We're doing it 3 months at a time just in case the feds change anything. Kind of the nexus in here that was so important is actually on the high deductible health plans and what the feds allow to be waived in health savings accounts. And had they not done that waiver, we would have had to treat the EPO folks better than the HCHP. So this allows the trust to absorb those costs of testing, and a big advocate of it. It lets them get the testing done without going to sit in a doctor's office and ER and whatnot. And if they call in, I know you got a question, Madam Chair, but if they call in to like Teladoc or something, they can't do the testing over that, but what they can do is run through the symptoms with them and help them decide if they need to go into a different setting. So we would recommend approval. Madam Chair?
Is there any way of knowing how many tests we've done through the trust?
We do know that, Madam Chair, and I have Rick online because we anticipated that question, and your reports are in there. He can actually hit the reports that are behind the memo. Rick?
Actually, Rick had to drop off. Aaron, this is Shay Beerley with Meritain.
Okay.
Oh, here, we got it right.
Is that Marina?
So if we look at,
Oh, here we
no,
go.
this is Shay.
Okay, Shay. Okay, and Shay, could you speak up a little bit, please?
Yes, I will. Is that better?
Yes, it is. Thank you.
Nikita Pereira. So we have testing for antibodies and also the
Has
testing
left the
for the
conference.
COVID. So we have several different areas that's happened at. So the testing for antibodies is
Has
at
left the
23,
conference.
and the testing for COVID is at 97.
Okay. Any questions on that?
Is there any idea how many of those people were repeat tests?
Did you hear that, Shay? The question is, was there any idea how many of those
Yes.
were repeats?
I did. We don't actually have that. We do have that unique members portion broken down. So we have, I'm sorry, we don't. It's broken down by confirmed cases by unique members, but we don't have that broken down by unique members that are tested.
Okay, so according to this document, and I'm sorry because I'm still having a hard time hearing, I'm assuming that you talked about what we have in front of us, that 143 members tested, members with confirmed COVID,
Yes.
4, and so members with exposure, COVID-19 diagnosed or suspected. But that doesn't
So
mean...
there's different diagnosis codes that are used during the billing process that identifies if that person has a confirmed COVID diagnosis or if they have exposure. So when that billing comes into Meritain, we're able to assess if that's actually someone with exposure. Those symptoms are, they just have exposure, they're saying they've had exposure, or they actually have COVID and they're being treated for COVID.
Right. It's a pretty low percentage of positives as to tested, and you know, this is just a little off the topic, but we're trying to get our numbers down so that we can open up businesses that are closed. So this is again a good sign of that, you know, over the months
Yes.
to have this.
Yes, these numbers look very, very good.
Right, and then when I see that number 117, because I think that these side numbers, the COVID-like illnesses and things like that, that is muddying up the waters for us.
Across the board.
Yeah, okay, thank you.
Thank you.
Thanks, Shay.
So I need a motion.
Move to retroactively approve extension of the COVID-related benefit changes through 12/31/2020 and to authorize Ken and Jade to work with ECA and Meritain to authorize successive extensions of 90 days each through a period of not to exceed June 30th, 2021.
Sure.
So we're not doing it 3 months at a time now. We're asking for the end of the year and then?
No, what we're doing is, good question, Berlin. What we're doing is 90 days, but with the giving Ken the authority to do it 90 days at a time through not to exceed June 30th, and we'll come back as we did here. So every time we do it, we'll come back for your authorization. Does that make sense? We want to make sure he can do it on the ground, because in the background we have to go through Meritain to make sure that both their systems and Teladoc's are set up to do it. So there's some lead time to get it done. So we basically call and say, hey, the recommendation is extend it, will you extend it? And then we come back to the trustees to get the authorization.
Thank you.
Have you been answered?
I think I'm like you. Just give us all the tests so we can get the numbers and kind of add it to our health assessment list.
Huge frustration, Berlin. Huge frustration for everybody trying to figure out what you're reading the tea leaves, and if you look, there's only 4 confirmed.
Yeah.
So it's been a nightmare to get. I mean, frankly, they're building the plane while they fly it, so I get that, but it's a big frustration for all of us trying to really parse out what's it really costing.
And the goalposts keep changing.
Exactly.
Right. I'll second the motion.
Okay, we got a motion and a second. All in favor?
Aye.
Opposed?
Aye.
Motion carries.
And if I could, Madam Chair, I apologize. I want to just state on the record relative, we don't need to go back to it. Maritain's actually got the best reports of anybody, too, just as a point of interest. We deal with other TPAs. That's the best one we've got. So I would congratulate them. Obviously, Shay did her homework trying to dig into it ahead of time, but despite the best efforts, it's still rough. So I just want to make sure that that's not a reflection on them, because the other reports we've got are just spreadsheets. This thing gives us a lot more information. Still vague, but it's better than anything else we've got.
Hey, Aaron, do we have any report on telemedicine? Are our employees using Teladoc significantly more now that we basically we waived the copay, right, on Teladoc?
We're not seeing, and I apologize, Madam Chair, I don't have yours, but across the board, we're not seeing it sustained. We did see the big blip in March and April, and it started to filter off in May. So the numbers are still decent, but we really thought we would see considerably more, and I'm not sure how to read that. I mean, if that's, nobody's getting sick, or if they're comfortable they don't have it, or what. But we expected to see a lot more than we're doing.
Because some doctors, that's all they'll do.
Well, some of them, they're doing telemedicine outside of Teladoc, because you can actually do
Oh, that's right. That's right. Okay, so I guess my question was, I guess that when the payment is the same, because you're getting charged the same, so we don't know if they're doing it inpatient or telemedicine.
Yeah, we don't know if they're going into the offices or if they're visual. And frankly, I've been doing that.
Have you heard anything from people, not just maybe our plan, all around? Are people satisfied with it? I mean, it matters what you're. I've heard things. I mean, I've had people who've had, arm injuries that, they have to look at it, and it just makes common sense, and so people it matters.
We're not. Honestly, we're not. I mean, the closest I've got, one of my kids is a supervisor and she's a pharmacist, a clinical pharmacist, and she's a supervisor at one of the larger hospitals in Phoenix. And basically, I ask her, how's your bed counts doing? And in Phoenix, they got back under 80% in their ICUs, and the number of COVID cases dropped to where they've shrunk again. That's it. I mean, it's all anecdotal. There's nothing, I don't have access to anything that gives me really solid data. So candidly, I think we're all turtles at this point. We're hunkered down, hoping the bad wolf goes away, and we'll see. Afterwards, we'll look at the data and see what actually happened.
Okay. Sounds good.
Aaron, just so I can add, Aaron, this is Marina.
Oh, hey, Marina.
If I can add, on the bottom of the first slide, it does show the Teladoc providers. The gray, telemedicine.
Oh, that's non-Teladoc telemedicine, Marina?
Yes, that's
thank you.
Non-Teladoc. So the blue is Teladoc, your gray is your telemedicine. Those are all your other providers, and you will see that those spikes are higher than your Teladoc. So we're seeing more and more doctors go to this level of care for their members.
And which page is that on, Marina?
For their patients. That's that first slide that shows the members tested, 143.
Okay.
And confirmed cases. At the bottom, you'll see the grid. The gray is your other providers. That's your telemedicine.
Oh, interesting. Okay, there it is. Thank you.
And then also, Shay, if I can also interject on slide 3, we also have claim numbers and claim paid amounts. So the third page of our report shows it broken down by Teladoc and other providers that are paid. And what is interesting also is to see the big spike we've had in behavioral health claims on the telemedicine side outside of Teladoc. So there is some information just to show what you were looking like the first quarter of the year, and then from March 23rd forward, which was the starting point where we started tracking this.
And just so you know, from a book of business standpoint, we've had a number of clients switch over and add telemedicine permanently to their plan doc.
And I think that's Marina from Meritain. I think that we have not seen anybody do that yet, but I won't be shocked by the time we come out the back end of this if that continues. That also required, and Marina can jump in, or Shay, but that also required some changes on how, like, the insurance companies like Blue Cross, who lease their network, what they allow in their contracts for providers. So it's not a simple world, but I think that'll be a really good one for people.
Comments or questions?
I think you voted on that one. I think you had a motion a second. I think we went back. I think you're good, right, Brian?
On 11.
Jenny, you're done? Okay. Okay, so Madam Chair, on the hearing aid, Susie, this is the one you were asking about earlier. So this is the one, so the history on this is, in terms of the medical plans in general, there are minimum essential benefits that have to be required. Hearing aids happen not to be one. The plan, for about, I want to say about 5 years, I'd have to go back and look, actually had a hearing aid benefit. It worked like vision. It was a $1 cap. There was a Blue Cross provider in the Kingman area that was providing the services. The Blue Cross contract basically has a bunch of codes. It says if you're doing this device, here's the number, okay? And then the only thing that the employee pays is their share based on the plan design. The provider should not be billing anything in excess of what they billed. What they agreed to at Blue Cross. And what was happening is that the provider in this particular case was billing considerably in excess of that. We worked with Ken and Jade, we worked with their predecessors on this. I actually wrote a letter at one point and got hit with a cease and desist order from Blue Cross from their provider relations division, and just said, hey, look, you're billing in excess of the contract, cut it out. It was posturing, but Blues didn't like it because it kind of breached their agreement. But their provider relations reached out and the billing never stopped. So we kept getting hit with these appeals for somebody who's in breach of their contract and ultimately threw up our hands and just dropped the benefit. So this is a request, and I'm not sure if the person's here, but this is a request to add hearing aid benefits back in. That old history, I would tell you, should not be a driver. But what has traditionally been done is that, and if you're going to add a benefit or drop a benefit, then what would typically happen is it would happen in the budget process. That's how we've done it in the past. It doesn't mean you're obligated to continue to do that now. If you wanted to look at this, whether it's now or for July, what would happen is we would go back, take a look at a benefit, a dollar amount, and give it to Chris to price on the actuary side, and then you could either add it or not.
Madam Chair?
Yes.
Madam Chair?
Yes, Susie, go ahead.
Yes, I reviewed this, and going to the background that Aaron has provided, I think we need to consider putting back the hearing aid benefit. It penalized our employees because of a provider's action. I think considering that there may be some people who may need this benefit, I think we need to put it back. Not wait until next fiscal year to put it back, but put this benefit, ask them to reprise it, and put it back. We have a good reserve. Let's just put it back.
What do you think that overall cost would be?
I literally have no idea, Madam Chair. It's been so long since we did it. Typically, if I, again, total guess, $250 per employee per month. Then it would go up from there. Chris, are you still on the phone? No, he dropped off. I'd rather defer to him, Madam Chair. It's going to be 100% cash, so all of it will come out of the claim fund because it's not one that would ever implicate reinsurance. It's not going to impact anybody on that side. So anything we do would be in the claim fund. It'll go up. It'll be, again, just argument's sake, $2 on the employee, $250 on the employee, probably a little less on the kid, $3 something on the spouse, $4 something on the family. It just reflects the nose count on how many people might be impacted by the benefit, and then you multiply that out.
Wait, I'm confused. So you're saying that every employee would have to pay?
Well, the premiums would have to be adjusted. It's whether or not the trust absorbs it, the county absorbs it, but you have to adjust the premium to reflect the new benefit.
Yeah, I don't know if I'm for that. For the amount of people that this would affect, that would get this, that it would help, as opposed to how many people that have no need for it would be affected. I don't know. Susie, can we bring back, more information on this for us before we make a...
Yeah, we can do that, Madam Chair. I mean, I think my feeling is if this was a new benefit, yeah, we could wait for it for the new year. But this was a benefit before, and it was not because we didn't have people who did not need it. It's because the provider was not coming up with their own contractual obligation. So I think that by dropping it and not considering it, we are penalizing the employees who may need it, who are part of the plan before. But I'm okay with you, get some estimates and get some impact, and we could revisit it once we know the dollar value of adding this to the plan.
When was it dropped, Aaron?
Amanda, are you on the phone? I'm thinking it was 3 years ago.
Yes, I'm on the call, and
Yeah, about 3 years ago.
I believe it was 2018.
2018?
Correct.
So the 18-19 plan year.
Okay.
Madam Chair.
Yes.
I'd be interested not only in the cost, but vendors that are available, services that are available, those sorts of things. And I guess also maybe kind of a history is where are we going as a society? Are there more and more people that are using hearing aids nowadays than 5 years ago, 10 years ago? I mean, I don't know really enough about what direction and what services and vendors are available.
I can, on that one, Roger, or Madam Chair, Roger, I mean, I was smiling as you said that. As a deafening middle-aged man, I'm sure there's progressively more, with the aging population. But again, I can run, it's pretty simple to do. We can run a benefit, create a benefit, dollar amount, because what it's typically done is you pay like 50% up to a dollar amount. Okay? So that's easy to calculate, and then we can come back with that.
Well, the other information too is what is the demographic of the county employees at this point. At least when I left, there were a little bit more creeping number going up on the aging level, and this may be a benefit that may be important to them.
And I think the other part, I'm sorry, Madam Chair, I can also get the list of providers in the county. See how many are out there.
So what's the suggestion that we ask for a presentation about this at our next meeting?
Sure. If you do that, Madam Chair, if you direct ECA to work with the actuary and staff to come up with a benefit and bring costs back at the next meeting, we can do that.
Right. Yeah. I want to have...
And also the list of providers.
What? Excuse me, Susie?
And also we may be limited if we don't have providers in the area.
Right.
That's easy to do, Madam Chair.
Okay, so is that okay, Susie, that we come back with for more information from ECA at our next meeting?
Yes, ma'am.
Okay.
Thank you.
Yes.
It says that one employee, it probably could have been me with my husband who needs a hearing aid, but I agree that mid-year is not the right time, so I will make a motion that we not change the benefit mid-year. However, ask that a presentation be made at our next meeting.
Second.
Motion second. All in favor?
Aye.
Opposed?
I opposed.
You opposed? Okay. Three.
Well, my feeling, Madam Chairman, is has to be within this year, not wait for the next fiscal year.
Yeah, I understand. Okay. Lucky number 13.
Okay, Madam Chair, these are just admin updates. So the PCORI fee, just again, information for you as trustees. This was something that died and was surprisingly reinstituted, breathed life into in the Trump administration. I never saw that one coming. But this stands for Patient-Centered Outcomes Research Institute. It's dollars that go to healthcare reform, ACA, that are assessed on every plan based on a per nose count. There's a methodology. Frankly, it adds up to billions across the country. And then what happens is we send them in, and in theory, they are going to do research, patient-centered standard and outcomes research and give folks back stuff on best practices. And again, I may have missed it, but I've seen nothing come out of this as of today. So we're just advising you, hey, look, we did the calculation. It's $2.45 for this trust. It was a little under $4,000. So that's just an advisory item. And then we'll work with the staff to begin to finalize the dates for the annual renewal conference for next spring. And that's all we have, Madam Chair. I'm happy to answer questions on anything you'd like.
Any final questions for Aaron?
No.
Susie? Okay, thanks again, and congratulations on your next steps. It won't be for a little while, but I know this is probably all a new chapter in your life, so.
Thank you, Madam Chair, and thank you all for just working. You guys are very collaborative, and honestly, the way you guys run this thing is why it is so successful, without a doubt. That's why it's just in the shape it's in. So I say that, don't screw it up.
Thank you very much.
Yep. Have a good day.
Thank you, Aaron.
Yep, thanks, Susie.
Okay, if everyone stick around, we're going to do the SIR. Let's take a break, a 10-minute break.
Madam Chair, that's at your discussion, but we do need Susie to stay on the line.
Yes, that's right. Susie?
Yes.
You stay on the line.
Yes, I will stay on the line for the next meeting.
Thank you.
Thank you.
Shay Early has left the conference.